Welcome back to Consumer Update. I'm Kelly Lightbourne. The relationship between men and women's physiology, aging, and hormones has led to the development of bioidentical hormone replacement therapy, or BHRT. Peaks of Health Metabolic Center is one of the leading facilities that offers these and other services. Here to tell us more is Dr. Tracy Lenhart, who is the medical director of Peaks of Health Metabolic Center. Welcome to the show.
Well, thank you. It's good to be back.
I know. I love having you here. Well, let's dig right in. I'm going to ask a simple question, but I think it's something that people don't really ask. What exactly is a hormone?
Well, a hormone is something that signals our body from one part to the other to do something.
Okay.
So like insulin signals the body to lower blood sugar and to store it as either energy or fat. So when we're talking about other hormones like testosterone, estrogen, you know, they do a lot of signaling. Like estrogen has 400 different functions in the body it does.
Really?
Yeah, so it's a very important hormone to the female body and men for that matter.
What are some of the signs of a hormone imbalance? I mean, I don't think people really know.
Yeah, I mean, it can be something as simple as loss of memory, because hormones play a big part in our memory. It can be something fatigue, it can be joint and muscle pain, it can be irritability. I mean, I always tell our women that progesterone is like female Valium. So when you start going into menopause, you lose your Valium. So it does a lot of different things in our bodies.
Okay, so what's the difference between, say, a hormone, and we hear about, you know, bioidentical, but is there a difference, or what exactly is the difference?
Well, the difference is some of the hormones, like, you know, the hormones in birth control pills are made out of horse urine. So, you know, they are not identical to our structure. So when we're talking about bioidentical, a lot of them are made out of yams, but the structure is identical to the human hormone. And how I try to explain that to my patients is that it's like the key to the lock and the locksmith.
Okay.
If that key isn't keyed identically to the lock, it may go in, but it doesn't turn it. It's the same thing with your hormones. If they're not identical to what you're using, it may hit the receptor, but it doesn't turn it on properly.
Ooh, that's a good analogy. That really made it kind of crystal clear. Because you always think about not having enough of a hormone as you get older, but you can also have too much.
You can have too much or too little. You know, a lot of our women, as you know, like for an example, a young person with PMS. You know, premenstrual syndrome. That's usually when they have way too much estrogen and not enough progesterone. So it's an imbalance of the hormones. And that happens, you know, when women in their 30s, they start the imbalance process because they start losing their progesterone, they start losing their testosterone. They don't lose their estrogen until they actually hit the menopause. So there's a period of what we call premenopause that causes a lot of imbalance in these patients.
So really, when you were just saying about having this specific lock and key that fits, that it is that they need to know it's a balance.
It is a balance. It's like a symphony. You know, if one instrument is out, the whole orchestra is imbalanced, and that's the way your body is. So if the one hormone is off, then the entire symphony may not work.
I would say, and the only way to find that out is to take tests, I'm assuming.
Exactly. We test the hormones, and it depends on, you know, what's going on with that person as to how we test. Like thyroid is a hormone, you know, that people may not realize how important it is because it's your metabolism, but it's the speed of every cell in your body. So again, you're balancing the adrenal hormones with the thyroid hormones, with the actual testosterone, progesterone, estrogen, and there's one called pregnenolone that people don't realize.
My head is spinning right now, so I have to assume that there's a lot of misinformation, because like I said, I'm all over the place right now just from what you were talking about. So how much misinformation is there out there?
Oh, there's a ton of misinformation out there about hormones. You know, we don't realize, you know, our body starts aging when those hormones start declining. So again, when we talk about anti-aging, I don't talk about it because I want the person on the outside to look good, although that's a benefit. You know, I want the organs on the inside to work well. So that person, you know, is on a tennis court at 90 and enjoying life because we're living longer, rather than in a nursing home in a wheelchair.
Now, how much misinformation regarding, like, say, testosterone? I know we hear that it gives heart attacks, for instance. I mean, is that
Yeah, that actual article has been partially retracted twice.
Wow.
It was an article in JAMA that was in 2013, and it was a very poorly done study. So, and it was a retroactive study. So in that article, what was interesting is almost 18% of the patients that they actually counted in the testosterone leg were only on it for 1 month. The levels weren't tested properly. They were using the wrong kind of testosterone. So it's been, there have been 2 partial retractions of that article already written.
Wow.
But it has gotten out there. It's the same thing as the Women's Health Initiative got out there. So it took us 20 years to realize that it was, again, a study that was poorly done.
And what about, I know I've also heard that estrogen causes breast cancer. What's the real story on that?
Well, estrogen can. Estrogen dominance and certain estrogens. There's 3 different estrogens in your body.
Okay.
And there was an interesting study that was just recently done on bioidentical hormone replacement. Now, not saying that this is, I think there has to be additional studies done to prove this, but there was one that recently came out that showed women with breast cancer that actually were on hormone replacement versus women that were not. And the women with the hormone replacement after breast cancer had lower reoccurrence of their breast cancer.
Really?
There's a study in France that shows lower breast cancer occurrence with bioidentical hormone replacement. Again, balance. You don't want the estrogen dominance because progesterone and testosterone actually protect the breast tissue. So we actually give testosterone to our patients with breast cancer to help protect them from a reoccurrence.
Wow. Now, is there a certain age that you should go in and start looking at this?
Well, women usually in their late 30s, early 40s start the process.
Okay.
And this is when they're at their highest risk for having breast cancer, because this is when, again, their progesterone and their testosterone go lower and their estrogen is much higher. So, we start looking at our women when they start having symptoms so they get through those periods. And people can choose whether they're going to do hormones for that period of time to get them through menopause, or they can choose to do them longer term in order to turn around and, again, protect their body long term.
Now, are there issues that younger people should look for?
Well, a lot of our younger people have a lot of estrogen dominance, and the reason for that is the hormones in our food.
Okay.
I mean, our milk, our cattle, everything is bred with hormones. So our girls are getting their periods much younger. They're growing breasts really early. And they're having a lot more PMS symptoms. So what do? We put them on hormones. We put them on birth control, but we don't realize we're actually giving our children hormones at that age.
Now, what are the different ways of delivering these hormones? Are there different methods of?
Yeah, there are many different methods you can choose. We use creams, we can use pills, we can use injections. We do a lot of pellets. I love pellets for hormones. Matter of fact, pellets were actually invented in the 1920s for women that had hysterectomies.
Oh, wow.
They use them almost exclusively in Europe, but they're just starting to come to the States. But yeah, we do a lot of pellets. That makes my hormones more regular. It's kind of more normal. Natural physiology. It's released naturally, so the patient has much more even keeled levels all the time.
So what can I expect? Because I've got to tell you, I'm 40 years old, so I'm right in that sweet spot, and I'm intimidated, to be honest with you, to go into, to see a doctor. What am I going to expect when I come in there?
When we come in, we do a lot of education of our patients.
Okay.
We have a lot of articles on hormones that they can read, give them a lot of education. Because I think a well-educated patient is, a much better patient. They're going to follow what you say. I don't want my patients to be, oh, whatever you say, doc. I want them to ask me questions, I want them to learn. And I want them to know about their body so they can tell me anything that's happening differently so we can correct it. But we go in, we test, and again, it depends what is going on with you as to what we test. It's very individualized for you. Our doses are customized. It's not a one-size-fits-all, so it's what your body needs to put it back to balance.
What's the best way to come in and see you? Do we go to the website? Do we call?
Yeah, they can go on the website. They can call. They can actually ask for a courtesy 15-minute consult.
Okay,
so
great.
They can actually bring their history in, find out what we would do for them, and find out if we're a good fit for them.
No, that's great.
Because that's a really personal relationship when you're dealing with someone's hormones. They have to be able to really make sure you click.
Well, doctor, thanks again for coming on the show. You always have a ton of great information.
Well, thank you.
Whether you're a resident of the Tampa Bay area or an out-of-town guest, the Hillsborough Area Regional Transit Authority connects you with the Bay Area's best destinations. We'll tell you more when we come back.